Okay, I'd like to call the meeting to order, please. Bobby, would you like to start out with the role, saying who you are, where you are, etc.?
Yes, good afternoon. I am Bobby Bagley, the Director for the Division of Public Health and Community Services. I am in our temporary location at 142 Main Street in my office with the medical student, Daniel O'Connell. This meeting is being recorded. It is a Zoom meeting that it's scheduled according to the governor's safe at home order. The meeting ID for this meeting is 822-7312-6095 with a passcode of 354498. A telephone number of 1-646-876-9923. And this meeting is being recorded as it is a public meeting.
Okay. Excuse my allergies, but Tony Storrs here, Chairman of the Board. I'm at my house. No one else is here except for my puppy. That's it. Stephanie?
Dr. Stephanie Wolf-Rosenblum, member of Board of Health, off-site, alone. There is no one else here, and I can hear you all well.
Okay, we're the only three, I think, that have to check in, right, Bobby?
I do not see Dr. Capetta, but I do believe yes.
There's Chuck. Sorry, Chuck.
There he is.
No, I just signed in. Sorry. Hi.
If you can tell us who you are, where you are.
Yes, Chuck Capetta, Board of Health, at my house with just joist heating and plumbing here in the basement, but they're not doing anything with the meeting.
Okay, thank you. Okay, I'd like to start the meeting, which is really a continuation of our last meeting, which went almost 2 hours, and we really didn't get a chance to discuss much. So I'm going to back up and put it back into Stephanie's lap like we did last time. And Stephanie, you want to carry the ball? You're really good with the science. So please get us rolling.
So to recap where we are, since we have other participants on the call that may not have been, we're here to discuss the possibility of recommending to the Board of Aldermen that a curfew for 9:30 p.m. be put in place. It is the role of the Board of Health to recommend. It is not our decision, but we examine the circumstances and the science informed by also the members of the members of the Public Health Department. What we know is that in the last few weeks, that there has been an exponential climb in the number of COVID cases, and our present case load and positivity rate is extremely high, presenting a considerable risk to the population for contracting COVID. We know that a vaccine has been approved, and hopefully a second vaccine will be approved at a meeting next week, but that the majority of the population will not be vaccinated until mid-2021 due to the logistics and the vaccine supply. And the vaccine appears to be safe and effective, but only 1 week after the second dose, which is administered after 21 to 28 days. We know that the hospitals are currently in planning for major surge capacity. It is not theoretical. And the concern is about the potential for spread in environments where the 4 things that we know help cannot be executed sufficiently. Those 4 things are masks, worn at all times, hand washing or sanitation before touching the face, mouth, nose, or eyes.
Yeah. Hang on, buddy.
I'm sorry, could people please mute? Thank you so much. Distancing at a minimum of 6 feet and greater if there is loud speech or singing. And finally, ventilation, which is most reliable when one is outside. It can be achieved in an indoor environment if the ratio of individuals and activities to the size of the environment is matched to the ventilation.
You said 2 minutes.
The concern right now is from several different areas. One is the burden of disease and the increased understanding that the majority of spread is through the air. It's not touching a contaminated doorknob or a contaminated surface. It is through particles that are expelled when people are talking, some of which remain suspended for 3 hours in the absence of those things that I spoke about. The second thing is that it is highly transmissible. A new estimate suggests that the Biogen conference in Boston, that it has now infected 300,000 people worldwide from what was presumably a single individual, because that conference did include a shared dining space without masks, and the hospital capacity, as we stated. We also know that Massachusetts has implemented a curfew, and that there is a concern that people, not only from New Hampshire, not that New Hampshire's rates are any better than Massachusetts, but just in terms of volume and spread. So those are the basic factors that I remember. We obviously are very concerned about making a balanced recommendation, again, a recommendation due to the potential impact on so many people, it being the holiday. Tony, Chuck, what would you add to that?
I would, one of the things that I would add is, I think I've heard every board member say this, that, you know, we're not out to hurt people or take their livelihood away from them or be the Grinch that stole Christmas, whatever. These are hard decisions to make. We just have to look at the pros and the cons in both directions. We have to look at it from both sides and do what we think might be best for the citizens of the city. So I wanted to kind of get that out there, as everybody knows that this is hard. Everybody knows that we've torn ourselves apart, pro, con, back, forth, done a tremendous amount of research on the internet, asked our staff to do research for us to send information that we might have missed from legitimate, reliable organizations and outlets that could help us make this decision. Chuck, would you like to continue? Please.
No, thank you. And I would echo my two colleagues' sentiments there, but if we're truly looking after the public, I would go further to say we have to have a healthy public to have a healthy economy, and one can't be without the other. So we're not the Board of Labor, we're not the Board of Commerce, we're the Board of Health that is making recommendations from truly medical perspectives in the interest of keeping our public safe. And the fact that over now 3,000 deaths per day, a milestone that no one thought would be happening, and even higher today, we can't keep putting our head in the sand and thinking that something, it's not going to happen in Nashua. It's coming to us. We're on the border of Vermont, Maine, you know, every state here has the same problem. So our hospitals are planning for surges, our clinics are planning for surges, the SCN, special care nurseries, the NICUs in my world are all being translated into different bed opportunities. So, you know, the medical professionals are really trying to get out in front of this. And this is this is, as my colleagues just said, not an attempt to hurt anybody, because we all live in the same economy, but the option to do nothing is not an option. And this is something, because we can either go to complete shutdown mode, and then we'll have no economy and no one have any lights on. So this is something that we're at least trying to do, to say, hey, we're taking this seriously, which I know we all are, and we just want to do what's the best for everyone's health.
And the other thing that, thank you, Chuck. And the other thing I'd like to emphasize is, as most of you have known from the start of this, it's been trying to hit a moving target. And that has made it very difficult for policymakers to make policy, and also for the common everyday person trying to live their lives to make a decision. You know, one day something is okay to do, the next week it's not okay to do. And that's made the public very confused, and I understand that. I sympathize with you. I've spent many hours studying and then restudying just because things change. So we're at this point in the timeline, and now we really need to make some decisions in which direction that we want to go. Is there any questions from the aldermen at this point? Yes, Alderman Liu first.
Thank you. I wanted to ask, I recall the last meeting, and there was some discussion that there's no strong science behind curfews. And I wondered if any thought has been given to, as an alternative, requiring, no inside after 9:30, no inside seating. I just wanted to run that by you. I respect the board's recommendation, but I did remember the thoughts about curfew. And I understand that this may simply be a stab at trying to get numbers in line.
Thank you, Dr. Liu. Alderman Liu. Sorry. I have seen various wrinkles on the curfew, from a hard curfew, which is you pick the time, from that point on, everybody's thrown out of the facility, to a more softer curfew, you pick the time, and they accept no more people in the facility, and those people have their 90 minutes, whatever is decided, to leave. I've seen curfews where, and we have to make the decisions, I've seen curfews where what they do is going from 100%, let's say, occupancy, cutting it down at let's say 9:30 to 50% or 25%, or whatever the case may be. So there's a wide range that can be adapted. Also, with the suggestion to the aldermanic board, there might be a way of not sunsetting it, but say we will review this in X number of weeks and come back for modifications. Stephanie, would you like to add that or beat me on that?
Thank you so much. If a curfew is implemented, and that is the only thing that is done, the science does not support that alone will reduce cases in the type of meaningful way that we now need to prevent the hospitals from being overwhelmed and from being unable to have sufficient resources, that includes staff, to be able to treat those who become seriously ill from the virus. I had purposefully listed the 4 things that absolutely do work. And at the last meeting, we did talk about and field a number of questions about what the potential implications of a curfew would be. And some people suggested, well, people would just crowd in beforehand, or they would just gravitate to sites that weren't monitored. There was discussion about, those downstream effects, which is why whatever a decision is made, whatever recommendation is made, it must be coupled with intense education of all business owners and of all patrons of why those 4 recommendations about the masking, distancing, washing, and ventilation are so critically important. Because if we don't have those things during the day, then we will continue to see cases rise. The intent of having a curfew is merely to try to reduce the cases in any way possible in an environment where people are not adhering. It's interesting what Dr. Storrs said about a moving target. Because when we first started to discuss this several meetings ago, the cases weren't as high as they are now. We hoped that people would be judicious over the holidays and that we wouldn't see this kind of spike this early in the winter season. But unfortunately, that didn't happen. And unfortunately, people continue to present themselves in environments where they are not wearing masks, at times when they're not eating or drinking, that they're not wearing masks. They go into an establishment and pull down the mask, and it's on the burden of the individuals in the store or restaurant to try to, remind them. I have seen this both by personal observation and by many communications. So whereas I hoped upon hope that we would not be still discussing a curfew, but there would be enough recognition of and adherence to those things that scientifically absolutely work, that we wouldn't need to still discuss this. When people talk about curfews, what has been done in other states, cities, towns, countries, is that things have reverted to, as Dr. Storrs suggested, only outdoors after a certain hour. So that might be takeout, or other, not necessarily that, shutting a place down at 9:30 without the opportunity for people to interact in that way is not necessarily part of a recommendation that I would support. However, I'm going to finish with something that my colleague Dr. Capetta said, which is that it's coming. And I'm not sure that was clear to everybody what Dr. Capetta meant. What it means to me is what's coming is a mandatory lockdown in the state over the Christmas holiday, like what's happening in Europe right now, because the cases got so high, the hospitals couldn't handle them. The wave of cases is already here, and we are in grave danger of having the public at great risk, because even people who are healthy are at risk for serious disease from the coronavirus. But the fact of the matter is that even in the child's population, pediatric population, but certainly in the adult population, not just in the elderly population, the prevalence of comorbidities, whether that's diabetes, arthritis, high blood pressure, asthma, or obesity, is astounding. Thank you.
Thank you, Stephanie. Chuck, I want to come to you, but if you don't mind, is Angela still on board? I think.
Yeah, I'm on.
Hi, Angela. Could you update us? We just had our meeting this morning for the COVID Partners Task Force. Could you compare the numbers last week when we were talking to this week, especially what's going on in the hospitals right now?
Sure. So for a comparison to last week, with our 3 community level transmission indicators, we have the incidence rate over the past 14 days. That is currently 903.1 new cases per 100,000 people. That's up more than 230 standardized cases compared to last week. And then our percent positivity category. So in the past week, there's been 459 tests conducted on average each day, and 47 of those tests have been positive each day, which gives us a percent positivity rate of 10.2% in Nashua. That's about 1% lower than it was last week. And for comparison, right now, the state's percent positivity rate is at 8.4%. And then in regards to new hospitalizations, we've had 2.2 new hospitalizations per 100,000 people over the past 14 days. That number is exactly the same as it was last week, but there is a lag in this number because it does take a while for the hospitalizations to get recorded in the reporting system. So we have been hearing from our hospitals that they are seeing an increased rate of hospitalization, and we're also seeing it with our disease investigation cases. More cases are being hospitalized than they were previously, but that number hasn't caught up yet because it has to go into the actual reporting system. So it's just, there's a lag time in that number.
Thank you, Angela. Chuck, if I can step on your toes one more time. Alderman Klee actually had her hand up a while back, and I said I'd get back to her. So Alderman Klee, please feel free to talk.
Thank you so much. I'd kind of like to make a statement, and then I do have kind of a question that may be for you or possibly Chief Carrigan. My first comment is thank you. Thank you for everything that you all are doing. You're doing everything to try to keep us safe. And I can tell you that I have been struggling with this. I get emails. We all get emails. You get them. The aldermen get them, and so on. More from people who are upset with this rather than people that are for this. And I think part of it is a lack of understanding and lack of education. So thank you for doing this. It really is appreciative. I can tell you that recently we got one that just kept on and on and on, referring to this as the flu, the flu, the flu, the flu. This is not the flu. Anybody who's listening, this is not the flu. We just lost our Speaker of the House. He didn't die from the flu. Sorry. And we have a number of state reps that are very sick. They don't have the flu. Sorry. They have a real disease, and we could lose more. I've lost 5 family members and friends. Sorry.
Okay.
My first question is, and I'll get it together. My first question is, do we have time to become stronger in our enforcement? In other words, I get calls regularly that this store or that store or this restaurant are not adhering. Chief Carrigan has been great when I contact him and so on, and they go and talk and educate people. Do we have time, with the way that cases are going, to enforce, and I mean enforce strongly, that if that means shutting somebody down, a single business down, they get shut down? So that would be really kind of my first question. We can't keep at this pace. We just can't keep at this pace, and shutdown is the option that is coming. And I agree with Dr. Stephanie that that is exactly where we're heading. So, and I apologize for my breakdown.
No problem. We feel sorry for your loss as well. This is important. I mean, I'll tell you, it might be time to step aside here because I'm dreaming COVID now. That's how much I'm involved with it. But I mean, these are hard questions to answer. Mainly, am I making the right decision? Left should have gone right. I don't know. I'm going to hold your question for the police department. I do want to get back to Chuck. Chuck, go ahead, and if something you want to add.
Well, Alderman Klee, thank you. I mean, it's a personal disease. It affects all of us. So please never apologize for showing emotions, because that's what we're all about. We're people, number one. And if we didn't have emotions, this would be a sad state of affairs. So I respect all of you and all the hard work that you guys are doing. So each and every day. So to answer your question, I would say we don't have time. My answer, honestly. because we've tried to give it time. We've kind of, like a parent, we kind of say, let's give you the benefit of the doubt. Let's try this, do that, da, da, da. But at some point, I guess I'm going to say, we need to be the parent in the room and have a backbone, make a decision, maybe rightly or wrongly in some point of view, as expressed last week. But, we can't be faulted for saying with all the tests, and this is a true disease. It's not a flu, like you said, but the time is now. And my comment, I guess, for Alderman Liu, who that was a great comment too, that, when initially we talked about this, about curfews, that we were saying maybe we're just copycatting the Massachusetts example. I would retort to that. I said, no, we're not copycatting anything. We're just responding to the people that we live with, work with, and go to school with, etc. And so medicine and science are interchangeable. You can't have one without the other. So 9 months ago, we didn't know what COVID was. So we called it something, and we've learned only through bench to bedside, and that's the expression I like to say a lot, is only through the science of understanding how this virus is working can we come up with a potential cure, a treatment modality, a plan. So it's a work in progress. So to wait for the science of curfew utilization or the effectiveness of curfew use, I think it'll be 6 months from now. We might have a study, we might have some project that looks back and said city X did this, and city Y did that, and kind of the scientists of the world, and I'm not considered a scientist, would say, yes, in probabilities, maybe that was an effective plan, but that's in the rearview mirror. We're going forward. I don't want to look backwards. And the forward vision right now is awful, scary, and we're not scaremongering, which another comment I heard last week. We're just stating facts, and we have to take our head out of the sand and saying it's hitting us today, every second. And again, I would just say we can't wait.
Thank you, Chuck. Stephanie, are you good?
I'd like to reserve comment until we hear from Alderman O'Brien, and I saw a few other people with their hand up.
Thank you. I don't see anybody's hand up, so I appreciate that. Bobby, do you know who might be wanting to talk of the alderman?
Alderman O'Brien.
Mike, are you there?
Thank you, doctors. Thank you for having us, and thank you for the work that you're doing with this board. We're going to need you. We're going to take your advice and weigh the balance. And as an alderman, I've heard, that's why I joined. I unfortunately missed the first meeting, but I did hear a lot from constituents, particularly within the business community. And so I'm here today to hear from you good folks, and plus with your recommendation. But Dr. Storis, I did like what you said earlier, the moving target theory. And I think many in the business community would like to have something. Now, I know I don't want to throw the onus, like for the enforcement, to the police department. The police department, in my opinion, has other laws and other things to take care of and enforce. But yet in the example of the fire department, where I have some 35 years experience, we've had a lot of situations where they have looked at overcrowding type of situations, particularly around the St. Patrick's Day holiday, the pre-Thanksgiving holiday, other type of events. But then again, this is something new. And yet, I don't know, and my question may be to Bobby with her division, would it be worth to have a tiered event leading up to a curfew of saying a curfew probably would be an excellent idea as a shirt pocket emergency thing, but are we there right now? And so the thing is, I would much rather have like a tiered up or ramped up program, such as maybe somebody from public health. If it's a matter of trying to find some money, maybe we might be able to find some money for the public health division, where people who are qualified to go into some of these establishments, they duly, and see if we can authorize them legally to do so, and to see if people are wearing a mask. Are they within the right boundaries of the proper amount of people, and make sure that is being enforced at this particular time. And if that doesn't work, then have a tiered up program. Again, another, to coin the phrase, moving target, but having the tier program to move up accordingly to something that we would need to do. And if we find that we come, then I would totally agree. Perhaps like a general shutdown is really needed if things become that acute. But the thing is that we got a way to balance with our business community. It's a very good decision. But basically, to have, I think, a program that is taken up to look at it in particular and to stick with doing the right thing. Is it within the police department boundaries? Not completely. I'm willing to see if we can look at something and, like I said, they get some like vision and to come out and try to work with this. So I just want some of your thoughts.
Was it just me? Or
well, no, I would say it's open because, thank you, doctor, because it's to you and, to the division director and other doctors and see what you think, as an alderman. We're going to need all your expertise. Absolutely.
Alderman Mike, what I was saying was the last third of your talk was chopped up and garbled. So I wasn't sure if I was the only one who didn't hear it, or maybe it didn't come across to everybody else.
It was very garbled.
Okay. So, sorry, Mike. Mike, I think you're on mute.
I'm sharing my bandwidth with the kids, with their the grandchildren, with their schooling.
Okay.
And plus being Irish, probably some of it was a little bit much anyways. But the thing is, to coincide it, can we have a tiered approach to this? Is it trying to get members of the Board of Health out there in the field to check to make sure, particularly the bar owners are in compliance, and threaten maybe with penalty or something like that of shutting down, and just to make sure everything's okay. So I'll throw it out there.
Thank you. I heard that, Mike. The first question, I'm going to let Bobby certainly address it first. Go ahead, Bobby.
Thank you, Dr. Sturz, and thank you, Alderman O'Brien, for your question. As far as the tiered approach and do we have the capacity to actually do that? The health officer, Heidi Peak, is on and does have some response to some of the efforts that the environmental health specialists are currently doing and do plan to continue to do. As far as a tiered approach time-wise, Alderman O'Brien, if we had started a tiered approach probably back around Thanksgiving, then we would be at the point of moving ahead. The time crunch for that has passed us. And I say that because we're right in the middle, the sandwich part of, we're post-Thanksgiving where we've seen an increase in cases, and now we're at the pre-Christmas onslaught, and we're still seeing an increase in cases as presented by Angela. That's ongoing with the case counts, the percentage of positives being in the red in 2 areas for us right now. The tiered approach, if it moved quickly, could be possibly something that would work, but we would be relying on environmental health to be able to do that. Can we get staffing on quick enough to respond to this in a matter of a week or 2? I don't know if that's possible. But Ren, who is our deputy health officer, and Heidi Peak, who is a health officer, are on the call that they could weigh in on that. Dr. Sturz, is that okay?
Yes, Heidi, would you like to go first?
Yeah, I would. Thank you very much. One of the things that we have been doing as a division is to use Bobby's term, we're all hands on deck, meaning that we're all doing something slightly different than what we do on a regular, normal day-to-day basis, with COVID as our foremost priority. But we're using all of our staff to do other additional duties, such as calling people, giving results, some disease investigation, answering the hotline, all of those things. So we're stretched pretty thin. It would be very hard to get somebody up to speed quickly. But one of our priorities that we've discussed a great deal internally is we know that there are some significant problem areas out there. There are a couple of, well, I would say that there are a couple of significant problems out there. And we are trying to the best of our ability to get out there and address those issues. So we are working with Liquor Commission and with the Fire Marshal's office to go out and do some checks of, I'll just categorize them as nightclubs. Those seem to have some of the scariest behaviors that we've seen. And so we've been out once, and I appreciate how the sentiments were, how well received we were out there, and how much the business community appreciated what we were doing. So thank you very much for that. I also want to thank the business community too for doing all of the things that make sense. You guys are making a difference, and we appreciate it. And we know that it's not everyone who is being irresponsible. So we want to get out more often and do some of those things, but it takes away somebody's hours during the day when they could be talking to people on the hotline, doing some other activities, getting out there in a more proactive manner.
Thank you, Heidi.
If I may follow up.
Yes.
Yeah, and the reason I came up with this concept is because every public assembly, as Ms. Peak, as you know, and many of you do know, you need a place of assembly, you need a certificate of occupancy. And within the, that certificate of occupancy has not changed. We have probably modified it now with COVID, but maybe there's something really we could do to have that CO, which is the certificate of occupancy, sunsetted, end it now, we'll readdress it later, to come down and have it more reflect the COVID pandemic that we have right now. And I know the fire department does go out and check that. Maybe it's a time to into division to help out another division. Maybe it's time to address that. In other words, like I say, I understand, Ms. Bagley, what you're saying, you know, is the time right for this? We probably should have thought of it earlier. But like I say, going with a total thing with the business community, I think a lot of them would like us to exhaust a lot of other measures if we could, prior to going something a little bit more radical. Because it seems like the knee-jerk reaction has been the Massachusetts shutdown. And so, you know, I don't think we're going to have the bus that they always come up for the voting up at Ward 9. I have yet to see that bus from Haverhill or anything, but I just wondered, are we having a lot of people from Massachusetts now coming up at 9:30 at night? And as a test, Diane and I, we went out and we went downtown to one of the restaurants and really didn't see it. So I really don't know. I'll believe the numbers, but you know.
Okay, I have some people in the queue. But
Yeah, thank you.
No problem, Michael. And I know Heidi is ready to bite off her fingernail, so I'm going to let her speak.
No, it's I'm fine, but thank you. Yeah, I just lost my train of thought. Sorry.
Last time I'm calling on you. Can I give somebody else a chance, Heidi? I guess so. Stephanie, I know Alderman Tom also wants to speak, but I'd like, Stephanie's been jumping up and down and waving her hand, so I'd like her next. You're on mute.
Okay.
There you go.
I have been waving, but I didn't jump up and down. I would love to hear what Alderman Lopez, so and so forth, has to say,
Okay.
and prior to my response.
Okay, Tom, are you still there?
Yeah, Alderman so forth. So my question is this. As healthcare professionals who are aware of not just the data behind the outbreak, the risks that we're facing, and at least 2 out of 3 specialists in specifically disease propagation, but who are also aware of psychologies, who are aware of compassion fatigue and effects on populations over a long period of time. Do you think we actually have the political insight or the public awareness to self-regulate at this point? Because I think that's what we're looking at. And I'm looking at the aldermen who are here. I know that several aldermen are opposed to this and are not even in the conversation. They're likely to be coming into this brand new, as if this was a new idea. And, you know, maybe you guys are jumping the gun and maybe we can do a tiered approach. And their experience is just not contiguous with the Board of Health or that of the healthcare professionals, who have at no point since April, no point been anything less than all hands on deck. Let's try every creative solution we can do. Let's try to adapt to everything. Are you certain that we don't need something more significant than this? Because my feeling is if we look at debating a specific point in time that may have been legitimate or may have been effective a few weeks ago and is not necessarily going to be effective now, the secondary effect of it is not likely to have any effect. And the secondary effect meaning a cue to the public that we actually are in an emergency. We are in the red zone. I think a lot of the non-inflammatory language being used here is falling short of saying we are planning overflow capacity because we are overflowing, and we are rearranging services such as state mental health beds because we don't have enough room. And now we're looking at scaling down elective surgeries and things where hospitals would love to make that money, but are already saying we're going to get overloaded. I don't think the public fully grasps that we are in the emergency versus maybe looking at it further down the road. My impression is this is because in April, when we shut everything down, everyone was shocked by the impact of that, by the difference in the newness, and spent weeks supporting each other and changing their lives and all that kind of stuff. And then we sort of went back to normal in New Hampshire anyway, where we did implement more health and safety things, but in Nashua, we expanded outdoor dining. We celebrated the success of that. We had, you know, people enjoyed the better walkability of downtown, and it kind of looked like a positive. We're going to do it next year, probably. That wasn't bunker mentality. That wasn't, we need to make sure we survive this, because we weren't facing that in here in New Hampshire. So I think that if what restaurant owners are telling us, that there's not a lot of people coming by after 9:30, but that tiny population that does come is essential, I think there's a contradiction there. And I think the secondary effect that they may be concerned about is if we have an actual curfew, if we tell restaurants to close after 9, is that going to signal everybody needs to be much more careful, everybody needs to stay in? Is that even going to happen at this point? I mean, is it too late to try to do warning messaging and that kind of stuff? And do we need to look at more extreme measures?
I'll take that as a question, Tom, and I'll let Stephanie answer. Plus, she has some comments. Go ahead, Steph.
First of all, to Alderman O'Brien's excellent suggestion about a tiered process, I would echo what Director Bagley said, which is that's a great thing to consider in reverse as we lighten up on whatever restrictions might be recommended. But from my perspective as a physician and a member of this community, that opportunity for starting a tier has passed. And to Director Bagley's point, had we done a tier at the time when we first started talking about things like that, tripwires, if you will, we would be at the final phase of doing something. Because I agree entirely with Alderman Lopez's description. Whether it is due to quarantine fatigue or the confusion that has arisen from this fast-moving body of knowledge about the coronavirus, as Dr. Capetta alluded to, I don't think people get it. I really don't. And yes, the hospitals have scaled down elective procedures. That means people who have been waiting months for knee replacements and hip replacements and are in grave pain are going to wait longer, which is another downstream effect of this virus. What we're talking about is not knee-jerk. We have been talking about this for weeks and months, and our worst fears are being realized. And I have to say that I do not believe that this has been taken seriously in the community, not just our community, but I don't believe, based on what we see, that this has been taken seriously, because we had a similar discussion prior to the Thanksgiving holiday. We sent out an emergency message that said, we're really going to have a problem if people don't take the precautions, if people don't listen to the concerns. And here we are, weeks later, seeing the spike that occurred because it's hard. It's hard to say, I'm not going to get together with my family. I'm not going to get in my car and go to a different state. I'm not going to, allow people in my establishment who are not wearing masks when they're not eating. But we didn't do it. And so, yes, we need to do something. And then we should have regular meetings with the business community, whoever that we is, whether it involves the Board of Health or the Board of Aldermen, to talk about, what we can collectively do. This cannot be the public health department going to establishments as they have and saying, you're not really following the rules, and then they leave and then the rules aren't followed again, because that's what's happening in some establishments, and we will all suffer for it.
Thank you, Stephanie. Alderman Clee, I believe you're next in the queue.
Thank you so much. I actually just kind of wanted to piggyback, I think, on what's already really been said. My concern is that we did get the message out, that people didn't listen to the message. So I just wanted to state that for those people that are feeling that we're suddenly doing this, this has been coming. You all have been talking about it. We have all been talking about it. Many businesses have been complying. But I wanted to just add to what Alderman so forth had said. And Tom had brought up a good point about restaurants, but we do have beyond restaurants. And I think Heidi mentioned that I should refer to them as the kind of the after hour places, the nightclubs and so on. And those would include places like the River, the Boston Billiards and so on. A lot of their businesses kind of start at that time. So when we're taking this into consideration of doing a curfew, and I'm not poo-pooing the public health, because I think that it's got to be our number one priority. You're all right. That does have to be our number one priority. Those are the businesses going to be hit the hardest, not so much the restaurants, because I think come 9:30, their business is waning. But those other businesses, those are the ones that are really going to take it in the short, so to speak. So I think I like a tiered effect, but I also hear what you're saying, too little, too late. So just as long as we take into consideration those businesses that will really be affected, not just restaurants, those other businesses, I think we need to address them. But that may not be your position. I think your position is well noted, and we should be listening. So thank you.
Thank you, Alderman Clee. Chuck, did I ever get back to you, or are you good? Or I'm sorry, I'm lost at this point.
Wait, oops.
Chuck, you're on mute. There you go.
Can you hear me? Yes. No, and Alderman Lopez, thank you. And I think, I'm going to give a visual too, because if we talk about mask wearing, we all think we know how to wear masks. Half the people I see in my office, when you put them on, which is over the nose and mouth at the same time and under the chin, we've had this demonstration before, talking to me like this, talking to me like this, talking to me like this, doesn't work. That's not mask wearing. So that's education number one. And even funnier is the reason they come in this case a blue and a white is the blue is supposed to be outwards. Even the facility people that come into my building now are wearing them backwards. They're not even catching what they're supposed to be doing. So education is lacking in so many ways. And you couldn't have said it better, Tom. The public, unfortunately, we're all the public, and we feel we all know, but unless it hits you personally, you're not going to take an interest in this, but they just have never heard it. And it just keeps happening and happening. But that's why for me, in the 6 years I've been on this Board of Health, it's been phenomenal. This is the first real issue that we can have some meat to talk about. Sadly, I wish it wasn't such a serious condition, but I think the time has passed. I'm echoing everybody else's opinions here. So thank you.
Thanks, Chuck. Any other questions? Seeing none regarding the alderman and the board, I'm looking for a motion. Chuck, Stephanie?
Well, I would motion that, given the census of the room, I'm proposing, or on behalf of the board, I would propose that the Board of Health would be implementing a 9:30 curfew if we're picking that time, and effective, I would say immediately. We can't wait another week, as we heard from Angela. We've had more deaths in the last week, and we've had opportunities for public comment. That was a great, over 100 people last week. It was phenomenal. And so I think if we keep debating this, we'll just keep pushing the ball down the road. And before you know it, Christmas will be here, and next week no one will want to do anything. So that would be my recommendation.
Thank you, Chuck. Stephanie, do you want to amend that or add to it?
Yes, please.
Thank you.
I support that recommendation. I would amend it to say that there should be no indoor activity after 9:30, that the aldermen consider allowing takeout after that time, if that would be of value to the business community. I also would like to recommend that at the same time, and taking Alderman O'Brien up on his generous offer to allocate funds for this endeavor, that monies be allocated for aggressive education of the public so that we have increased safety during the day by people having a recognition of how this is spread and how a mask is worn and so forth. And finally, to a point I had made in a prior meeting, to also have the aldermen consider an amendment to indoor entertainment, which is of live entertainment, which is another significantly risky endeavor because singing spreads the virus 25 feet. And so those would be my recommendations.
Thank you, Stephanie. What I'd like to do, with your permission, would be to separate those so that you're really voting on some different things, so we get whatever across without tripping up the other things. So, oops, somebody wanted to say something? Bobby, do you have that motion?
I have that there. The Board of Health is making a motion for a 9:30 p.m. curfew with no indoor activity, but allow for takeout to continue, that there's an allocation for funds for aggressive education to increase safety during the day, and to consider an amendment to the indoor entertainment because of singing spreading the virus more than 25 feet.
Okay, so what I'm going to do is bundle the curfew at 9:30, no indoor activity after 9:30, and takeout is okay after 9:30. I also like to add to that a provision, possibly Stephanie, Chuck, that we revisit it, that sometime in the future, whether that's 6 weeks, wherever, to modify it or to change it as needed. Stephanie, Chuck, are you okay with that? Go ahead, Chuck.
Yeah, I guess my question would be how to modify it, but I think it's just going to be, at least if we have it have it that we'll review it and continually address it and not
Right.
on the back burner because it's a live event, not a static document, that I 100% agree with.
Yeah, that's what I'm looking at, that that what we're doing isn't static. It's constantly changing. It also will help the restaurant people know that, this isn't going to be forever. That we have sympathetic ear. We're going to be reviewing it. Hopefully it's going to get better, but if it gets worse, it gives us the ability to amend if things get worse. Stephanie, are you okay with that?
I am, but I would not wish to put a specific timeline on it.
Okay, we can just leave it open-ended.
The only thing that I would ask that we would do in conjunction with it, and this may be a discussion for after we vote on it, is that, to Dr. Capetta's point, the Board of Health issues have not been acute urgent issues in the past. They've all been able to wait. Our next meeting, if I have my schedule correct, is the 13th of January, which is the day after the aldermanic meeting.
Okay.
And so I would think that we would want to create an environment where we could reassess the situation prior to the next aldermanic meeting so that we could have a schedule of rolling recommendations to the Board of Aldermen.
Mhm.
I know that'll take some doing with some public notice about our meetings, and I know that may take some changes in our schedule, but I think we owe it to our citizens and our business community to make sure that we remain on top of this, and to the point that's been made about tiering, that the tier be able to go in two directions.
I agree. I think that can be handled as housekeeping, where we just move our Board of Health meeting from the 13th to some other time, and we can discuss that. We don't have to take up everybody's time on that, but it's a good point.
Right here. Hi.
So seeing that, I would like to bring it to a vote. And Bobby, can you reread the regulation, the recommendation from the Board of Health to the Board of Aldermen?
So I have that there is a recommendation or a motion to put forth a 9:30 curfew with no indoor activity after 9:30 p.m., but allow for takeout to continue after 9:30, to allocate the funds for aggressive education for the public, increase in safety during the day. And I know that you're going to split some of this up. Consider an amendment to indoor entertainment because of singing, spreading the virus more than 25 feet. Revisit their curfew in 6 weeks to modify or change as needed, but I believe that Dr. Wolf Rosenblum is saying to take that out.
I would just leave it that we will review it in the future.
If I could make a legislative suggestion, since Attorney Bolton isn't here.
Absolutely, Tom.
As it was read, I didn't hear anything specific to restaurants or dining establishments. So indoor activity could include anything from hospitals to shelters. So you just want to add something in there that specifies exactly what types of businesses.
Thank you, Tom. I think we were thinking that, but we certainly have to articulate it. Okay.
All right, so then do we want to modify the motion to include
Mhm.
specifically who we are referring to with the motion for a 9:30 curfew with no indoor activity? And then we need to state where.
Yeah. Stephanie, go ahead and wrap it up for us.
I have a suggestion on how to phrase it to address the concerns that have been raised by Heidi, and so that we are fair to not single out certain titles of establishments. But I would say it would include any establishment where masks cannot be worn the entire time the person is inside, such as a restaurant, a bar, a nightclub, or any other social club where there is eating or drinking that would necessitate taking off a mask. Something like that. That might be too wordy, Tom, but
Yeah, Tom,
that's the intent.
as our visiting parliamentarian, Tom, what do you think?
Personally, I think that nails it. By doing the general rule and then adding specific examples of it, it should be something that can be adapted, but also is specific to what your needs are. And really, what we're talking about is the unmasked behavior as the largest concern. So I would go with that.
Yes, very good. Alderman Clee, is this in regards to what's there?
Yes, it exactly is. And so my
Okay.
question would be, I absolutely agree with what Dr. Stephanie said. My question would be that some of the establishments that I mentioned that don't have to have eating and drinking with them because they have other activities, would, if they said no eating and drinking in this establishment, would they then be able to stay past 9:30? That will be the question that will be asked us. So that's
Like a
the only
bowling alley?
clarification I want. A bowling alley, or even like something like the river or the billiards, where they don't have to eat and they don't have to drink while they're there. Just putting that out there. But I love Dr. Stephanie's wording. I think it's really good. Thank you.
Stephanie and Chuck, do you believe with your amendment, Stephanie, of indoor entertainment, that would cover that? What Alderman Clee is talking about?
So we have a specific purpose here, and that is to make sure that we do not have unmasked behavior. Ideally, that wouldn't occur at any hour during the day, but the issue, to Alderman Lopez's comment, is it's unmasked behavior. So I would personally have no problem with stating that if an establishment could amend their rules so that, or their business practices, so that all of the activities are masked with no drinking and no eating, not what you bring in and not what you purchase, then that would be okay with me if people think that that is doable. Would Heidi or Ren like to comment on that to aid us in our formulation?
Heidi or Ren, any comments?
Yeah, I'm thinking about it. I know that the businesses that do are kind of on the fringe, and again, that it's not necessarily the charitable gaming that I was thinking about. It's more the nightclubs, actually, where there's dancing and live entertainment that's involved, including DJs. I think that would probably work, but I'm not sure whether or not those businesses, the other ones, can survive without the alcohol revenue, and if it's worth it for them to actually remain open. And so that's more of a business type of thing, and I don't know whether or not it's what Liquor Commission will or won't allow.
Meaning that they could not stop selling liquor at a certain time and not interfere with a license?
Well, they have a license, and the license allows them to sell liquor during hours of operation. So that's a little tricky for me. And then the food is dependent, the alcohol is typically dependent upon the food service as well. Other than say you have pool tables, you don't have to provide food in that instance. So I'm not sure how to navigate through that. Ren, anything you want to add?
You're on mute, Ren.
Sorry about that. I would just add that it's going to be very challenging if you allow adoption of measures to work around a curfew. How are you going to enforce that? And then if you have to wear a mask, how do you ensure that the distancing guidelines are also being followed? So the ultimate question, I think, is what is the ultimate goal, and how do we achieve that safely to balance the economic piece with the public health piece? So those are the concerns I would have with the kind of all this random kind of challenges to modify the behavior and the creativeness that we may see that comes out of that.
Thank you, Ren, and thank you, Heidi. The other thing I would probably try to emphasize is keep it simple. If it gets too confusing, there's too many rules, too many exceptions, we all get lost in the woods. So, Stephanie, what do you think? Can we?
Yeah, I mean, I'm thinking, again, everything that we have discussed, everything we have done is not knee-jerk. So somebody presented something and it would be easy to say no. But that wasn't my first reaction. My first reaction was, well, maybe we could, but then what happens if somebody buys 2 drinks at 9:30? You're gonna come and have them spill it out? You're gonna clear away their food? You know, so it is very, very complicated. And to the points that have been made, it's not just, you know, to emphasize to people or make an example of how serious this is. We are in crisis. Mm-hmm. And to my mind, the kinds of things that we're talking about maybe this and maybe that, are the kinds of things that we could work out in discussions with the public health department, in discussions with the with the business community, which we have asked for at each meeting, as to how we're going to open things up as quickly as possible. So I would agree that we should keep it simple as we implement and then tear backwards.
Okay. Bobby, can you read? Stephanie, do you want to say something else?
Alderman Lou had her hand up. I don't know
Thank
if you could see her.
I'm sorry, Alderman Lou, I missed you. Go ahead, you're on.
No, that's okay. It seems as though the difficulty is if we had Attorney Bolton with us, we might be able to get through some of the questions that we're stuck on here. But it also seems like I'm not familiar with whether you need a watertight motion right now, or whether you need to adequately convey to the alderman on the meeting what you're looking for, and possibly before our meeting we or you will be able to meet with Attorney Bolton and get the answers to some of these issues ironed out. But I understand. I also wondered whether a curfew at 9:30, unless an establishment chooses to voluntarily discontinue their food and beverage service so that all patrons can wear masks. And, I wonder if that's the way to do that. That's all I thought.
Chuck, please.
Yes, I think, I don't disagree. I think we, like we said, maybe going in when we can reopen things and go in the other backwards direction. But right now we're in hunker down mode. And if we carve out for this, carve out for that, the bowling alleys will say, well, we've never served food, but how are you going to accommodate? We've accommodated if we just say unmasking in our referendum. Then we haven't talked about washing, social distancing, and ventilation. So we're putting those kind of out to lunch. So the last time I went bowling, I was standing pretty close to the person I was, bowling with. So I think we either say all or none. This is where we're at. And if individual businesses, entities, organizations need to ask us again and redress this on a weekly, daily basis, then we can take that offline and deal with it. But I think we have to start from the top and make it as broad in the sense of this is where we mean, and underneath that we can have some, maybe at some point in the future, some changes. But right now, everyone's going to raise their hand and, like Mr. Ely said the other day, that we all have our own agendas, and I just don't think it's time for agenda stuff. The agenda right now is keeping people healthy, and I'm really afraid of people coming back and saying, I'm not serving alcohol, but I can let you dance 2 feet from me. I think that's a scary kind of proposition.
That is true. I would like if we Any more discussion? Feel we're kind of going around in circles here a little bit, in a good way, not bad.
So
Bobby,
can we go back to, can we reread it again, Bobby? Because I'd love to have this back to the 9:30 and see how we think.
yeah, that's what I was going to do. Unless Bobby, somebody had their hand up first, and I don't want to cut anybody off. You're good?
I don't, yeah,
You look good? Okay.
I don't
Let's-
see any hands.
All right, then let's go ahead. Like Chuck said, let's reread what we're going to be voting on and go from there.
So am I gonna read it with the additional language? I'll read the last thing.
Yeah.
A motion to adopt a 9:30 curfew with no indoor activity after 9:30, which would include any establishment that cannot wear masks the entire time on site, bars, restaurant, nightclub, and with no eating or drinking where masks have to be removed. Allocate funds for aggressive education for the public, increase safety during the day, considering amendment to indoor entertainment because singing spreads the virus 25 feet, and revisit the curfew or review the curfew in the future to modify for changes as needed.
Sorry. Do we want to clean up some of that, Stephanie?
I think to Alderman Lu's point, the intent of what we are trying to achieve, to protect the public and to protect our common interests, is clear to the alderman by what is being read, and the actual ordinance, if they choose to so do, will be crafted with the assistance of Attorney Bolton and others. So I would not see a need to continue to wordsmith unless the aldermen wish us to be more specific.
Thank you, Stephanie. Any comment from the alderman? Alderman Clay?
Thank you. Just a quick comment. I agree completely with Dr. Stephanie. You have done all the appropriate work and so on, and I think it'll be legal that will clean it up, and trust me, the alderman will have something to say about it. So I think you've made your point, and I think it's perfect. You'll be at our meeting so we can ask you questions as to intent if there's any aldermen that have any of those questions. I think it's best just to do what you've done and move forward. So thank you.
Alderman Clay, just a point of information, when is the next alderman meeting? I think tomorrow, right?
I don't think so.
Okay.
Let me double check.
There is not one tomorrow.
No,
Okay.
I know there's not one tomorrow, so
I
we
would
even-
recommend calling an emergency meeting, or at least asking the president if she's willing to.
I was just going to
would
say the same thing, yes.
I would say that. I mean, if we're saying that this is important, we want to get it on the docket and moving on it. We don't want to, like Dr. Chuck said, we don't want to get wrapped up into the holidays and then get really, this is a January issue instead of right now. It's important. Okay.
We don't meet again officially until the 22nd. So that would be a week from tomorrow. So we probably are going to have an emergency meeting if they can find time on the schedule.
Okay. If
And-
they do, please let us know.
Yeah, and if I may too, just a parliamentary procedure, it's going to depend upon the president of the board. But this board here makes a recommendation to the Board of Aldermen. I don't know if the president wants to ship it to another committee. And
True.
that's where it could hear testimony at that particular time. A lot of that wordsmithing could be done, at that particular committee and then come before the full board for review, so it depends what the president wants to do.
Yeah. Thanks, Alderman Mike. I trust you guys will handle it and do the right. Are we ready to take a vote?
I wouldn't trust us. Don't forget, most of us aren't actually healthcare professionals. I think you should be there to explain things because only some of the board is here now, and this is going to be its own meeting. So
Okay.
we're going to need your input. You might even want to consider asking for like a joint convention or something.
Okay. Well, let's let that flow through Bobby. Is that okay, Bobby?
Yes.
Okay, thank you. I am now ready to take a vote. Stephanie and Chuck, those somebody saying something or not? Okay. Those in favor of the motion as read by Bobby, please say aye.
Aye.
And those opposed, seeing none, it's unanimous. Thank you, guys. It's a lot of hard work. Thank everybody for all the input, the millions and millions of hours that people have put in behind the scenes. Let's hope this does something and get us out of this muck, okay? That being said, I do have to open it up for public comment because it is a public meeting. Bobby, you're in charge. I see Joseph's hand up, so I'll take Joseph. I mean, the rules are, basically there's like 50 people on this meeting. So if you spend 10 minutes, we're never going to get out of here. But I'd like everybody to have the opportunity to talk. And if you can keep it to 2 to 3 minutes, if you have a question for somebody, feel free to ask the question. Go ahead, Joe. You get your first batter up.
Hi, folks. Joseph Holofrowich, First Church of Nashua. One is a statement about wondering whether the Board of Health has looked at the recent contact tracing study that was done in New York State that actually listed a fantastic number of percentages of where they found transmission issues to be found. And basically anything with restaurants or anything else outside of education and healthcare and home gathering seems to be under 2% of the cause of cases. So I think those numbers are important to at least look at as you further discern. My question is, listening to the discussion today, well, first of all, a statement for Alderman O'Brien, or for the board as well. The certificate of occupancy numbers have already been altered by the state, that we're supposed to be all in wherever we are. We have those percentages. So I'm not sure whether Nashua is beyond those numbers or not, or whether they're looking at going beyond the state recommendations. And my last thing, which is probably the more prominent, is the spirit of your recommendation to the alderman now. Will it affect houses of worship on Christmas Eve after 9:30 p.m.? There are a handful of churches in the city that do have worship services on Christmas Eve after the curfew. So based on your, I guess that's the biggest question that I have that I'd like some insight on.
Okay. Anybody want to take that on? Go ahead, Stephanie.
So relative to houses of worship, and to clarify for the purposes of the Board of Aldermen discussion, to my mind, that would not fall under the category we are speaking about, because that does not involve an environment where the main activity requires you to remove masks. There has already been guidance from the CDC that houses of worship should maintain social distancing, and that people in attendance should wear masks and should limit activities that would spread the virus far, such as singing out loud. Relative to other areas of transmission and contact tracing, this is something that we constantly will have and will monitor through our healthcare professionals on the Board of Health, but are at this time focusing on those activities where the known things that reduce cannot be maintained.
Thank you, Dr. Wolf-Rosenwald.
Does that answer your questions, Joe?
Yes, it does. That's all I need. Thank you.
Thank you very much. Enjoy the holidays.
Dr.
Next.
Stearns, Aaron Pinkakick, sorry, Aaron.
Well, that's fine, however you'd like to pronounce it. I'm used to it. So just a couple of comments here is, it's clear to me that you've done a lot of work and you've put a lot of thinking into this whole process, and I appreciate that for the safety of the citizens. But, my concern is if you look at the statistics that I saw this morning, the transmission rate for this virus in restaurants and bars is somewhere between 1% and 2%. The transmission rate in family gatherings is north of 70%. It appears to me that you're solving a problem that doesn't exist, and you're doing it at the peril of the small businesses in Nashua. And that just doesn't seem right to me. And you ought to really think hard about doing something like this. It feels to me like this is a knee-jerk reaction to do something because you don't know what to do. And that's not the way you handle problems like this.
Chuck?
Yes, so thank you, Aaron, for that input. I think you've said it a couple times already. We pride ourselves on not being a knee-jerk group. This is not a, just let's think of something because our mass border people have thought of something too, and let's follow suit. It's, again, don't mean to sound like a broken record, but I don't disagree with your 70% infectivity rate in households. It gets back to education because people still, like Representative Lopez had said, we've all said, people don't think it's happening to them or it never will happen to them. And so they're living in a reality that isn't real. And I'm not trying to offend anybody when I say that, but when you're on the front line, writing death certificates because of COVID-related illness or working in the ERs or the NICU where I work, and seeing all this, it's hot and front and center. So we have a long way to go with public education. So I 100% agree with that. Aaron, that's perfect. I think but we have to have personal responsibility. We can't dictate what we're asking. We're asking just the question is, how can we start showing people that we're taking this seriously? And this is one effort to do that. If we drop everything else, then this is a useless event. But this is one in a long list of other things we're trying to accomplish.
Right, and there's a lot of brain power involved in this, and that's important. But you're focusing on the wrong part of the problem.
You want to continue, Chuck, or are you good?
Well, no, I'm good. I can't say anything other than I don't disagree. But short of every household, every parent, every individual look in the mirror and say, what am I doing to lessen the risk? Am I still going to have Christmas, Hanukkah, New Year's as the way we did in the 4? We're going to make the hard decisions and not traveling. But every parent has told me in the office over the last few weeks that they understand it, but they're going to make some adjustments. But there's a stubborn few that still say, I'm still going to Aunt Mary's house. I'm still going to have them over for dinner, because it's not going to happen to me. And maybe you don't see it, but I'm seeing it. And so this is the problem with public health. The public doesn't always understand the health side of things that we're trying to address. So I respectfully disagree with you on that, but on that topic.
Can I make a suggestion to the chair?
Certainly.
Public comment is best used as public comment. You guys had the asking questions and discussion back and forth last week. And you're never going to get through everybody who has an opinion to share. The public has the right, the literal statutory right to make a comment. And that's what you're addressing here. So you might want to just let them say it. I know sitting up at the alderman and having your, decisions rehashed or even having people say disrespectful things about you is difficult to take, but I mean, they're allowed to say it. You might want to just move forward with it.
Okay. Thank you, Tom. I also give the right that if one of the doctors feels there's a core issue or somebody's didn't get the point across exactly, I don't have a problem recognizing them and letting them address it. Stephanie, you were next up. You had your hand up.
Actually, to Alderman Lopez's point, I'd like everybody in the public to be able to speak. And then if it would be appropriate for me to comment in the aggregate at the end, I'd appreciate that opportunity.
Okay. Other comments? Bobby?
Yes, Kurt Mathias has his hand raised.
Hold on a second.
Let me unmute myself here. Kurt Mathias, Boston Billiard Club and Casino. I have one question for the group. And my question is, what is the difference between somebody eating dinner and having a drink at 7:30 at night or 10:30 at night? Thank you for taking my question.
Okay, thank you. Next. Bobby, next person.
I don't see any other hands raised.
That being the case, does anybody want to? Okay.
Oh, I see a hand.
Minister Ray.
Yes. I'd like to say that I'm encouraged about what we've done here today. As I listen to Dr. Rosenblum, though, I do feel that maybe it's not enough, and not saying we need to do anything else right now, but I'm saying maybe we should look at new ways to get people separated even more. Maybe not, you know, one of the things I was thinking about is maybe coming up with a way of having people not go to so many jobs, cut down on the amount of work to just the stuff that you need, figure out a way to pay people so they can stay home. But I'm saying basically fewer people working, more PPP, more people sanitizing, and just look for ways to separate things, because that's what this virus does. It thrives on people being together and contact. And the virus doesn't care about the holidays. It doesn't have a sense of humor. It doesn't feel pity, remorse, or any of that. It only cares if you get close enough so it can get into the next body. And so I encourage the board to think more about that. I'm done.
Okay. Thank you, Minister Ray. Any other questions or comments?
I don't see any hands raised.
Okay, Stephanie wanted to answer questions in the aggregate. So Stephanie, the floor is yours.
Thank you so much. I truly appreciate the comments about trying to invigorate the distancing and the PPE. This is very important, and it is why I am pleased that part of our recommendation to the Board of Aldermen is that we invigorate the education about how this virus spreads. Because even when everyone is vaccinated, and until this virus hopefully runs its course, which, based on the 1918 pandemic, when we didn't have a vaccine, but we also didn't have the kind of mobility that we have now, it took 2 years. The vaccine is not 100% effective and such, so there will be a role for PPE and distancing and hand sanitizing for months and maybe years to come. To the question that Mr. Mathias asked, there is one difference between dining that occurs earlier and dining that occurs later, and that tends to be the amount of drinking that occurs or the cumulative amount of alcohol. Alcohol reduces people's defenses and it reduces judgment. This is a scientific fact. And so people are more likely to become less meticulous about their, you fill in the blank, masking, distancing, washing, sanitizing, and such. But it is true, and we have touched upon this, that we also need to make sure that all the things we can reasonably do during the day are also done, because there is also risks at that time. And lastly, to the question relative to transmission in families versus transmission in restaurants or other settings, the data would support that your likelihood of getting coronavirus dining at a restaurant is double what it would be in other environments. And the issue is not that the closeness that occur in a family doesn't cause a higher level of transmission once the virus is in that family. But the question is, how is it getting to that family? And to a point I made at the very beginning of our discussions, the Biogen conference, which appears to have started with one individual that came from overseas, has now infected over 300,000 people worldwide. And so it is about a person starting a chain of events that leads to great illness and sorrow. So I truly appreciate these comments. I look forward to more dialogue with the community, with the Board of Aldermen, and with the business community. And I would, on behalf of myself, but the Board of Health, as we wrap up this meeting, wish everybody a safe and healthy and joyous holiday season, as different as it will be this year.
Thank you, Stephanie. Chuck, any closing words?
No, I'm in awe of all the hard work of everyone's doing, and I love the fact that we can have respectful dialogue. It's phenomenal. It's great. Thank you.
Thank you all. I appreciate you giving your time, your effort, your expertise, your patience. Let's hope the pandemic ends soon. Hope of all hopes. Enjoy the holidays, enjoy your family, but be safe.